Hi guys, how are you doing? Welcome to the Zyzven Naturals Effect, Brews and Breakthrough YouTube channel. I know you're not familiar with having me on this side, but you have to twist it up a bit sometimes. So today we are going to look at fibroids. Just give me a minute to get this started. Okay, there we go. One moment, guys. I'm new to the YouTube thing, so give me a minute to settle in. So, of course, hi, Karine. How are you doing? Do remember to share the live. If you haven't already subscribed to the page, do subscribe. And we are about to get this, our first YouTube live going. Now, guys, so let me tell you a bit of background why I created this page. Because you always have to diversify what you're doing. Hi, Iris. How are you? Good day. I still want to be in touch with you guys, but at the same time, I want to not everybody is on the other social media platforms. So here is a platform, good afternoon, here is a platform where everyone is able to get the information. Yeah? Everyone is able to get the information. So that's really and Karine, you were the one who encouraged me to go over to YouTube. So thank you so very much for that encouragement. For those of you that are going to be joining later, for those of you who are going to be watching after the live has been streamed, if it's your first time meeting me, then my name is Shanafi, and as they like to say, the brain behind the Zyzven Naturals brand. So for those of you that are familiar with me, welcome to a new environment. And as I say, today's topic, I probably should have introduced myself, but I will do that another time. So it's a mix. This page, as you see, the name of the page is called the Zyzven Naturals Effect, Brews and Breakthroughs. Brews and Breakthroughs. And part of the reason for the name change is that there is so much that goes on in Zyzven Naturals. As a female entrepreneur who has a family to maintain and also does a bit of helping out, empowering people. I wanted to have a platform that would highlight the different aspects of being the person who leads this wellness brand, and plus combining the family life, the travels, and everything else that is part of it. And that's why I thought the name, the Zyzven Naturals Effect, is so suitable, so reasonable. All right, so let me know what you guys think. So we are going to, let me see, yeah. So today, as I say, we are going to be looking at fibroids today. Just have to get my old notes going for you guys. Yes. And so we're going to be looking at fibroids today. And bear with me, it's my first live over here. If you guys know me very well, then you know that I am notoriously shy in new environments. So I am doing my best here, guys, so bear with me. So the fibroids is such a large topic to cover. So for the purpose of this live, we are going to be looking at fibroids and how it affects the Black woman, yeah, from the, from my community. Of course, generally it would refer to everybody else, but I want to look at it from the black woman perspective, and especially us Caribbean black. So let's get into it. So black women are 3 times more, hold on guys, yeah. So black women are 3 times more likely than women of other races to get uterine fibroids. And these, of course, are non-cancerous tumors in the wall of the uterus. That's according to the Departments of Health and Human Services. Fibroids are largely genetic and there are no known way to prevent them. That is what they say. Over here at Zyzven Naturals, we say something completely different. So, there are 2 main types of fibroids, guys. Fibroids can grow in any part of the uterus. Also not true, it grows inside the uterus. There are different names depending on where they are found. So you have the intramural fibroids, and these grow within the uterine wall, the uterus wall, or the wall of the uterus. And then we have the submucosal fibroids, and they grow in the hollow cavities of the uterus. And we have the subserosal fibroids that grows on the outside of the uterus. So it's basically 3 types, yeah? Hi, Nads, welcome. So most of the times women don't know that they have fibroids because they don't have symptoms. But when the fibroids start to actually grow, when the fibroid starts to grow or increase in numbers, they can cause large numbers of problems, from pain to bleeding to miscarriages to problems with urination and problems with bowel movement. I think it's when we start having these symptoms, or when women start having these symptoms, that they would normally or generally get a diagnosis of having fibroids. Yeah. So when fibroids do make themselves known, the first sign is often heavy bleeding or pelvic pain. There is an estimate out there from the United States that says that 25% of African American women, so 25% of black women, will suffer from fibroids by the age of 25, and 80% will have them by age 50. And that 80% is compared to 70% of Caucasian women. Because black women suffer fibroids at an earlier age, and they also are because black women have fibroids at an earlier age, then they're 2 to 3 times more likely to undergo surgery. So, statistically, but what about those who don't fall within the statistics? Fibroids are most common in women that are aged 30 to 40. I think it is discovered in those women because that is at the age group where, if you are a person who wants to have children and you haven't naturally conceived a child, that is at the age group when you start to seek medical intervention. And it's usually when something else happens that fibroids that don't present symptoms are discovered, which most fibroids really don't present symptoms. Or most people with fibroids really don't have symptoms, yeah? Fibroids occur more often in black women than in white women. We said that before. They also seem to occur at a younger age and grow more frequently in black women. So what really causes this? I don't know if I should put my personal opinion, but I always think that a lot of the illnesses that are predominant in the black community oftentimes are exaggerated because of socioeconomic issues and not really the physical part. Good morning, Delia. We do go to the doctors later. We are told we are raised to have a high pain tolerance or a high tolerance of discomfort. So by the time a lot of us that belong to the Black community get to our doctors, then the situation probably has gone to stage 2, stage 3, and that is why we tend to have more surgeries, because our conditions are discovered much later. Yeah. So sudden changes in hormones like estrogen can lead to this sudden growth. A large fibroid cluster can measure to more than 8 inches in diameter or larger, which is about the size of a small watermelon. Fibroids of this size, so of that 8-inch size, fibroids of this size can directly impact a woman's weight. And that is why you tend to see that a lot of people that have fibroids, a lot of women that have fibroids, they also tend to have this protruding stomach and generally overweight. Not all. There's always exceptions to the rules. Yeah. Fibroids of this size can directly impact a woman's weight beyond about 4 inches in diameter or the size of a grapefruit. A doctor needs to be consulted. Morning, Anne-Marie. A doctor needs to be consulted, as this can impact other organs such as the bladder and the lungs. There is also an increased risk of blood clots or ruptures. And if you don't already know it, then fibers can and do rupture. So, as I say, there are no known cure for fibroids, and to this day, researchers or those in your conventional medical scheme do not know the reason for fibroids. Some data suggests that a low vitamin D level can increase the likelihood of developing fibroids. And one thing I would want to say on that, and probably part of the reasons why so many Black women have fibroids, is that we were told, a lot of us are from the tropics, and we were told that, oh, you'll get your vitamin D from the sun. That's really bullshit. So a lot of us, we say, oh, because we're in the tropics, because we're in the sunshine, because we have this darker tone, then and we will take up our vitamin D. Totally the opposite, because the melanin actually block the uptake of vitamin D. You will never take up enough. Yeah. So Black people have lower levels of vitamin D, which may contribute to their higher risk. Black women have higher rates of obesity, which is also a risk factor for fibroids. Women who have symptoms, the most common signs and symptoms of uterine fibroids are: 1, heavy menstrual bleeding. It is oftentimes when this menstruation becomes, or the bleeding, the flow becomes unbearable, to the point where we might not be able to use a normal sanitary napkin or a Tampax or whatever you use, and you have also graduated from the maternity napkin and you're really wearing a adult diaper. That's probably the point where a lot of us say, no, this is not normal. Yeah. So that is probably where a lot of us then seek help and discover that, oh, this is caused by fibroids. So the common symptoms or signs are heavy menstrual bleeding, menstrual periods lasting longer than a week, so it's both heavy and long, pelvic pressure or pain, that constant contraction in the pelvic area, frequent urination, as we say, depending on where the size of the fibroids or the amount of fibroids, it can directly rest on other organs. And one such organ is the bladder. Another such organ is the lung, and then it affects your breathing. Difficulty emptying the bladder, constipation, or backache or leg pain. So there are always things we can do. There are always food that we eat that affects, that will either mitigate or helps with fibroids. So refine what some of the foods you want to, some of the foods you want to avoid, because fibroids actually do feed on these. You're talking about your white foods. So we're speaking about, and when I say white, I mean white in color of the food. So refined carbohydrates, yeah, pasta, white bread, white rice, cakes, and cookies. So whatever is refined carbohydrates and those things that are also very high in sugar. So another factor that affects fibroid is stress. I think not enough of us think about that, how stress affects the physical. Yeah. So stress is not always a bad thing. It's an indicator of something else. So let's see. Stress is the body's biochemical response to life changes. To handle stress, the brain tells our body to produce extra hormones. As a result, hormone levels rises, which stimulates fibroid growth and causes symptoms to flare up. Stress can cause fibroids that were once asymptomatic to grow at an alarming rate. So avoid stress at all costs, even if you don't have fibroids, but especially if you do. So again, fibroids can cause heavy bleeding, debilitating abdominal pain, or a lot of us like to say cramp, and pelvic pressure. While the complications they cause typically aren't life-threatening, fibroids can change the structure of your uterus and affect your fertility. Once a medical profession can only a medical professional can determine if the fibroids you have are a cause of concern, and that is because based on the size and the location of the fibroids, they'll be able to tell you that this is affecting this organ or it's not anything we need to worry about. My personal advice is, even if they tell you that your fibroids is 0.5 millimeter in size, I think small problems have less complicated issues. So if they tell you that it's a really small fibroid and it's not affecting any of your organs, I think you should not delay. It is easier to flush out, to reduce a small easier and faster to flush out or reduce a small fibroid than a larger one. So why wait? It is going to grow or multiply. So why wait for it to grow and multiply? So what can you do to stop fibroids in their tracks? 1, avoid added salt. Yeah. Limit high sodium products, so like your processed and packaged food. Check your blood pressure regularly. I haven't done that presentation on this platform, but I will do it, the correlations between hypertension and fibroids. We also need to exercise regularly. If you're overweight, if you have a lot of belly fat, you want to lose weight, you want to limit or completely avoid the intake of alcohol. You want to increase potassium by eating a majority of plant-based meal, yeah? So you eat raw and cooked vegetables and fruits, dried fruits, whole grain, brown rice, lentils and beans, whole grain bread and pasta, quinoa, and fresh and dried herbs. So those are some of the things that you can do to mitigate the effects of fibroids, yeah? So as we said at the beginning of this presentation, a lot of people say, oh, I am gaining weight because I have fibroids, which is partially incorrect. That's not why you're gaining weight. But let's look at that. Fibroids themselves do not cause true weight gain, but some fibroids can become very large. and in some cases weigh a few pounds. So it will never be enough for you to explain why you're 250 pounds and 5 feet 6 inches. These larger fibroids can press on other structures in the abdomen or pelvis and appear to cause bloating and swelling around the abdomen. So it is the action. So the obesity or the large swelling is a secondary action of fibroids because it dislocates and other organs and it does make you bloat. Basically, it swells up your stomach. Now, a lot of people, however, truly gain weight when they have fibroids. And I will explain weight as in fat, not just the stomach, yeah? And I will explain why. So overeating happens when a patient feel anemic. A lot of people who have fibroids also suffer from anemia, and it is really pretty easy to understand why people with fibroids will suffer from anemia if one of the symptoms of fibroids is long and heavy bleeding. Yeah, so it's very easy to understand why someone would suffer from anemia, or a lot of people or most people with fibroids will also have anemia. So overeating happens when a patient feels, or a sufferer, a person that has fibroids, feels anemic as a result of the heavy bleeding. They try to make up for what feels like a loss of calories. Women also may feel like reducing their normal exercise, as the iron deficiency can make women feel frighteningly lightheaded, which can make exercise very tasking. And if anyone has ever suffered from anemia, you know that you're often very fatigued, you're often feeling really, really dizzy and very low on your energy. So the question then, since we have spoken a lot about losing weight, the question then, or the weight, the correlation between obesity and fibroids. So the question then is, does losing weight helps to prevent fibroids? It is commonly recommended to those who have fibroids to try to lose weight because it can help to prevent further fibroid growth. Fat cells make more estrogen, and sudden changes in hormones can lead to fibroid growth. Having a healthy weight, good diet, and regular exercise routine can help prevent them. In addition, avoiding chemicals that can affect hormones, such as pesticides and paint, can help. While fibroids and weight loss might not seem to go hand in hand, it is possible and helpful to reduce one's weight to help reduce your fibroids or slow down the growth of fibroids. So here are some basic tips in dealing with fibroids. 1, be aware of iron deficiency and use vitamins and diet to correct it. Eat brightly colored fruits and vegetables. Eat foods high in fiber, such as, your broccoli, that kind of stuff, or oats. Get enough vitamin D, which can lower your risk of uterine fibroids by 32%. So then you see how important vitamin D is. Yeah? Avoid food that affects estrogen, like soy, tofu, and red meat. Avoid sugary food and refined carbohydrates. So we also spoke, or I also in the introduction spoke about the fibroid belly, having this protruding stomach when we have fibroids. So as fibroids grow, the uterus sometimes need to expand to accommodate the fibroids. Your uterus is a muscular organ that can transform from the size of a fist to that of a baby. Don't we all know that? And even larger. Many women first notice an expanding waistline when clothing begins to fit differently. So again, the sudden changes in hormones and primarily estrogen can lead to this sudden growth. A large fibroid cluster, again, can be 8 inches. 8 inches is about the size of a small watermelon. So we like to say, 8 inches about, that's 5-month baby pregnancy. So the second thing you want to look at is also chemicals and hormone exposure, or how the exposure to chemicals and the effects it has on our hormones. So whether it is from food, beauty products, or birth control, Black women are regularly and overly exposed to toxic chemicals and hormones. Hair relaxers, in particular, have been linked to an increased risk for fibroids. The endocrine disrupting chemicals found in these products can increase the production of hormones like estrogen and progesterone, which can cause fibroids to not just grow but also form. Fibroids also depend on estrogen to grow. Any source of hormone imbalance that causes estrogen to be dominant can contribute to unwelcome symptoms. So what about those that are in their 60s and beyond? Those that no longer get a menstruation. So once you go through menopause, theoretically, fibroids should start to shrink because they don't have the hormones that were being produced by the ovaries to help them grow. But you know what they have and why this is no longer true, that the effects of fibroids are less once you hit menopause, because while our ovaries may not be producing the hormones anymore, the food that we eat, the beauty products that we use, still exposes us to these hormones. So I did mention that one of the ways you can keep your fibroids in check or monitor your fibroids is through your blood pressure. Let's look at why. Studies suggest that the presence of uterine fibroids is associated with increased blood pressure levels. And the prevalence of hypertension in women with uterine fibroids has been shown to be as high as 40% more than those without uterine fibroids. So again, uterine fibroids and hypertension does go hand in hand. Uterine fibroids may also burst because of an increase in the blood pressure or abdominal pressure. A twisted fibroid can injure our fibroid that has grown too large for its blood supply. Increased blood pressure or acute blood loss are serious complications of a ruptured uterine fibroid. If left untreated, fibroids can continue to grow in the uterus, both in size and numbers. And that is why I said earlier that if you go to the doctor and you have one of those kind fibroids, so one of those baby ones that's not really affecting anything, and your doctor say to you that, oh, leave it, it's not affecting. While it might not come to the level where you want to perform surgery, you should use other methods to flush that fibroid out or shrink it, because look at fibroids like babies. They do grow up and they do get chubby and they do multiply. Yeah. So if left untreated, fibroids can continue to grow in the uterus, both in size and numbers. Bleeding will become heavier, and it may be accompanied by severe cramping and anemia. As fibroid grows, the abdomen also swells. So as the fibroids grow, your stomach also becomes bigger because the uterus has to expand. Remember, it's a muscular organ. So the uterus has to expand to accommodate the growing fibroid. So there are a lot of things in nature that helps to shrink or maintain or reduce or flushes out fibroids. So Vitex, fish oil, and B complex are just a few supplements that has been known for creating a better hormonal balance. Additionally, the fatty acids in fish oil or cold water fish to be exact, helps to fight inflammation that contributes to fibroid growth. Then let's see. Let's look at your conventional way. So how your regular doctor would look at fibroids. So the first thing they will do, they will put you on medications. They will treat, good afternoon, Miss V. They will treat the symptoms. Yeah, they will treat the symptoms of the fibroids. So if you're having the heavy bleeding, sorry, they will put you on the birth control, contraceptives, without explaining to you that you guys know it's the worst thing you can do. Put yourself on contraceptives, because contraceptives is basically masking the issue, treating the symptoms, but not getting to the root cause of the problem, which is hormonal imbalance. So medications can help shrink fibroids or ease the symptoms, oftentimes ease the symptoms. Surgery may involve removing just the fibroids or your entire uterus. Some treatments your doctor may recommend include, and this is the first one they always go for, hormone balancing medication. So basically medication that releases progestenes, yeah. They can also do surgeries. They can do the uterine artery embolization, which works by blocking the blood supply to the fibroids. So basically they're starving the fibroids. They can do surgery that removes the fibroids, or they can do a complete hysterectomy that removes the uterus. Of course, here at Zyzven Naturals, we like to say we look at the other effects. We look at the way nature intended our bodies to work, and therefore we always look at the herbal alternatives. So there are a lot of herbs that help with fibroids. A lot of these herbs, by the way, are in our uterine fibroids products from Zyzven Naturals. Green tea, because of the bioflavonoids. They help to reduce the size. Green tea helps to reduce the size of fibroids. Chasteberry for heavy menstrual bleeding and to balance the hormones. Good morning, Keish. So before we go, the pain from fibroids is best described for those of us who we don't have the diagnosis that we have fibroids, but the pain is that acute stabbing. Thank you. Is that acute stabbing pain and swelling in the abdomen. The pain and the swelling are caused by the release of chemicals from the fibroids as the cell dies. So once you're treating fibroids, so I've heard customers say it to me that we take, the first time we take the Zyzven Natural products for fibroids. So the first time we take the uterine tonic, for example, the pain gets a bit worse the first days of and the explanation is the pain and swelling are caused by the release of chemicals from the fibroids as the cells die. Yeah? So that is why, but it doesn't continue. Those of you who have taken the products, then you know. So guys, we have come to the end of our little presentation on our first YouTube live where we looked at fibroids. Why did I choose fibroids? Because predominantly I serve the Black and brown community, and fibroids is predominant among that community. So I wanted to not start off by doing an introduction. Most of you already know who I am, but by speaking on a topic that affects this community so much. So thank you guys for listening. It wouldn't be fair if I go without, and I'll put it in the description of the live once it goes up on this channel. But what you want to be looking at is your uterine tonic your uterine tonic, that along with your alky detox with moringa and your womb detox for fibroids. But the key to remember is the uterine tonic. All right, guys. And where do you find it? On online at zyzvennaturals.com. But if you're in Jamaica, if you're in Canada, then Canada, it is Zyzven Naturals, TKINC. We do ship worldwide. There is local shop in Jamaica and local sellers in the Caribbean. So just leave a message in the comment section. Let me know how I did on my first YouTube live. I am so nervous, guys. So let me know how I did in the comment section. You know what they say in patois: encouragement sweeten a labor. And if you're watching the channel, like the content, guess what? Subscribe to it, share, give a like, keep it active, and we might just give you a little bit more. So thank you guys for listening. And the hormone balance blend, the hormone roller. So thank you guys for listening. That concludes the formal part. And remember, this is where we will be going. We'll be mixing up the lives. So some of the lives will be here. Some of the lives will be on the other platform. But as we grow and build, invite your friend to this channel, man. Come on. Like our content, share it up. All the best, Doctor. Continue to empower. Thank you, Delia. And if you have question, oh, thank you, always observing. Thank you, thank you, thank you, thank you. So I can take a few questions. I'm trying to keep this live to under 45 minutes. So we're at minute 37. So give me your questions, I'll answer them. But if I don't answer them on the live, then guess what, guys? I will go back through the comment section and answer them for you. All right? Thank you, Karine. Thank you. Thank you. And as I say, the channel, the name is self-explanatory. It is called the Zyzven Naturals Effect, Brews and Beyond. So it's more than just the tea. Oh, thank you. Anne-Marie, it is very impossible for me to call customers. You know, I have a full day. So I apologize. I completely apologize. That's why I have sellers, you know, to take some of the burden off me. So I know I did promise to call, but as you see, I've been out doing our work in Africa. I've been going to school, trying to get this medical herbalism thing done and over with. So we can start, you know, on a deeper level. Before I go, I want to, if those of you who haven't seen it, a baby was born yesterday to the Zyzven Naturals family. A baby girl was born yesterday to the Zyzven Naturals family. So congratulations over there in New York. Congratulations. Congratulations to the mommy. Thank you. Thank you. But I will reach out to you, Anne-Marie, more than likely tomorrow morning. Yeah, more than likely. Thank you. Yeah, thank you. As you also see, we announced a pregnancy that is halfway through. So the young lady that is pregnant, oh, it is just so amazing. It is just so amazing. The young lady was recommended to us last year because she has PCOS, polycystic ovary syndrome, and she also had fibroids. We took the approach of trying to shrink the fibroids with the uterine tonic, but we quickly got her on the products for polycystic ovary syndrome, PCOS, to balance her hormones. She did want to have a child also, but that wasn't why she came. And by balancing her hormones, as you can see yesterday, she hit the 21-week mark. So just past halftime, that baby will be here just about after the summer. So congratulations to that young lady over there in the States also. So a lot of good things are happening, and that's the thing, guys. When I say, when people come to us at Zyzven Naturals and say, "Oh, but everyone says I have this or I have that, and so it's impossible for us to get pregnant." Once your hormones are working, then nothing is impossible. Once your hormones are in balance, not imbalance, then nothing is impossible. Which also means that if you're not planning to get pregnant and you have an issue where you need to balance your hormones and you're still a woman of ovulation and reproductive age, then guess what? Take the necessary precautions. All right, guys? So you guys have a beautiful, beautiful, beautiful day. Like the content, recommend your friends, subscribe to the channel, share the channel. Thank you until we see each other again. And if you are just meeting me, then my name is Shanafi. But you can say Nafi. Catch you guys another time. Bye-bye.